Hi, this is Dr. Ty from Premier Orthodontics. In this video, we're going to answer the question, can Invisalign fix crossbites? So we'll describe two different types of crossbites, how you can tell if you have one, and then answer whether Invisalign can fix these different types of crossbites. We'll also show you actual before and after photos of patients who receive crossbite correction, so that way there's no mystery around the process. So let's get started. So today we're talking all about crossbites and Invisalign. But as a reminder, we post braces and Invisalign related content to our channel every week. So if you're thinking about getting braces or Invisalign, make sure to subscribe to see more Invisalign and braces related content. So most people have probably heard the term crossbite, but most don't fully understand what a crossbite is. So before we start talking about if Invisalign can fix a crossbite, let's first define what a crossbite is, as well as the different types. So today we're going to talk about two different types of crossbites, a posterior crossbite and an anterior crossbite. If you've never heard these terms before, that's fine. We'll next describe each type of crossbite and show you examples of each one. So what is a posterior crossbite? The word posterior means further back in position. So a posterior crossbite is a crossbite that occurs on the back teeth. In cases of posterior crossbite, the upper teeth will be more narrow than the lower teeth. So ideally, the upper teeth should be wider than the bottom teeth and should sit outside of the lower teeth. This image here is a good example of how we want the back teeth to sit. Now let's look at an example of a posterior crossbite, where the upper teeth sit inside of the lower teeth. In this picture, both sides of the upper teeth fit inside of the bottom teeth. This is called a bilateral posterior crossbite, because it's a crossbite that occurs on both sides. Another type of posterior crossbite is when just one side of the upper arch falls inside of the lower teeth. This is called a unilateral posterior crossbite, and the picture here is a good example. You can see that the teeth on the right side sit entirely inside of the lower arch. So now that we've defined what a posterior crossbite is, let's discuss anterior crossbites. So what is an anterior crossbite? The word anterior means nearer to the front in position. So an anterior crossbite is a crossbite that occurs on the front teeth when one or more of the top teeth fall inside of the bottom teeth. This picture here is a good example of a single tooth anterior crossbite. You can see that just one tooth on the upper arch falls behind the lower teeth on the lower arch. Another type of anterior crossbite is where multiple teeth sit behind the lower teeth. This is sometimes called an underbite. So this patient here is a good example. Both single tooth anterior crossbites and underbites are defined as anterior crossbites because they occur with the front teeth. So you may be wondering why orthodontists consider crossbites a problem. Aside from the fact that crossbites don't look great cosmetically, they can also cause some significant tooth and jaw problems over time. Crossbites can cause a traumatic bite leading to chipped and damaged teeth, asymmetric jaw growth, TMJ and jaw joint problems, restricted airways leading to snoring and other bite problems. So not only can crossbites become physically uncomfortable if left untreated, but they often get more difficult to fix as one gets older. So now that we've defined what crossbites are, let's discuss which type can be corrected with Invisalign. We'll also show you before and after photos of patients who had crossbite correction in our office. So first, let's talk about posterior crossbites. If a patient has a mild posterior crossbite, they can usually be treated with a combination of Invisalign and crossbite elastics. This type of treatment usually works best when there's only a single tooth in crossbite. This patient shown here is a good example. You can see that just one of the teeth in the back are in a crossbite relationship. In this animation, you will see how braces and rubber bands can be used in combination to correct mild crossbites. The process is essentially identical with Invisalign and works the same. The elastic bands gradually expand or constrict the arches to help align the teeth. So the patient shown in the previous photos was treated with Invisalign and crossbite elastics. You can see that the strategy was effective by comparing the before and after photos. This type of treatment is effective in patients who don't have a severe posterior crossbite and only need minor correction. Next, let's discuss treatment of a moderate posterior crossbite. If a patient has a more serious posterior crossbite, a combination of Invisalign and a quad helix expander may be needed. The patient below is a good example of a moderate posterior crossbite. This patient has a unilateral posterior crossbite or a crossbite that occurs just on one side. These type of crossbites are usually difficult to treat using Invisalign alone and will often need a combination of Invisalign with a quad helix expander. In this animation, you can see how a quad helix expander can help expand the upper arch and correct a moderate posterior crossbite. Quad helixes can be used in combination with Invisalign trays. They are usually kept in for a period of 4 to 6 months. Once the expansion is completed, they can be removed and the patient can continue with standard Invisalign treatment. We actually have a separate video all about quad helix expanders. If you'd like to check it out, we'll link to it in the description below. Now let's talk about how we would correct a severe posterior crossbite. If a patient has a severe crossbite, the combination of Invisalign and a rapid palatal expander, or RPE, may be needed. This type of expander expands both the teeth on the upper arch as well as the bones of the palate. This type of expander is generally used only in young children and in growing teenagers. So since this appliance is designed to expand the bones of the palate, it can be done successfully only within that age range. The patient shown here is a good example of a severe posterior crossbite that would benefit from a rapid palatal expander. You can see that this patient has a bilateral posterior crossbite, or a crossbite that occurs on both sides. This animation will demonstrate what a rapid palatal expander, or RPE, looks like, and how it can help expand the upper arch and correct a severe posterior crossbite. So notice in her before and after photos that she was able to get full correction of her posterior crossbite through expanding the upper arch. If it is determined that a patient needs an RPE, this can be done before Invisalign treatment begins, or sometimes at the same time during treatment. So generally speaking, it's difficult to correct a moderate to severe posterior crossbite with Invisalign alone. And most of the time, some form of expander will need to be used in combination with Invisalign aligners. So now let's shift gears and discuss how we fix anterior crossbites with Invisalign. And as a reminder, an anterior crossbite occurs with the front teeth. If a patient has a single tooth anterior crossbite, these can usually be successfully treated with just Invisalign aligners. The patient shown here is a good example of a single tooth anterior crossbite. You can see that just one of his front teeth sits behind the lower teeth. So with the patient shown before, you can see that using only Invisalign, we were able to align his teeth and correct his anterior crossbite. So fixing a single tooth anterior crossbite is much simpler than fixing an anterior crossbite that includes multiple teeth. Multiple tooth anterior crossbites, sometimes called underbites, are generally more complicated. And this patient here is a good example of an underbite. So underbites can be treated with Invisalign, but it may involve a combination of elastics with Invisalign aligners, or sometimes even extractions. So we actually made an entire video about underbite correction. If you'd like to learn more, I'll link to it in the description below. But just to show you that it is possible, we'll show you the before and after photos of the patient shown before, who was treated in our office with Invisalign, demonstrate his underbite correction. So in this video, we discussed two different types of crossbites and how they are treated with Invisalign. So most of the time, posterior crossbites may have to be treated with a combination of Invisalign and some type of expander, but it is possible. There are certain types of crossbites that may be treated more efficiently with braces, but the only way to know for certain whether braces or Invisalign will work best for you or your child is to have a consultation with an orthodontist. If you're living in the Phoenix, Arizona area, we would love to see you for a 100% free consultation. At this consultation appointment, we'll discuss the best way to fix your crossbite, whether braces or Invisalign will work best, and answer any other questions you may have. If you have any questions about crossbites or Invisalign, feel free to ask them in the comment section below, and we'll do our best to answer. If you found this information helpful, please help us out and give this video a like. Also, if you'd like to get notified when we release new braces and Invisalign related videos, make sure to subscribe to our channel and tap the notification bell. If you want to learn more about underbite correction, you can click over here. And to see our most recent video, you can click right here. Thank you so much for watching, and we'll talk to you soon.